Are there risks with local anesthesia in plastic surgery? Imagine going into a procedure thinking it's completely safe because it's local anesthesia. While it is generally safer than general anesthesia, it still carries some risks that are important to understand. Local anesthesia works by numbing a specific area so you don't feel pain during the procedure. It's often used in plastic surgery for minor fixes or regional blocks. But like any medical intervention, it's not without potential complications. One of the rare but serious risks is local anesthetic systemic toxicity. This happens if the anesthetic enters the bloodstream in too high a concentration. Symptoms can start within minutes and include feelings of agitation, confusion, dizziness, a metallic taste, or ringing in the ears. In more severe cases, it can cause seizures, abnormal heart rhythms, or even cardiovascular collapse. In extreme situations, it might lead to respiratory arrest or coma. Recognizing these signs quickly and treating them with measures like airway support, seizure control, and lipid therapy can save lives. This toxicity can happen if too much anesthetic is used, if it's accidentally injected into a blood vessel, or if the patient's body doesn't metabolize it properly. In procedures like liposuction, delayed toxicity can occur up to 12 hours after the operation because the anesthetic is absorbed slowly. Allergic reactions, although rare, are another concern. Some people might develop skin reactions or, in very rare cases, severe allergic responses called anaphylaxis. These reactions requiring immediate treatment with antihistamines, epinephrine, and supportive care. Cardiovascular effects can also happen if epinephrine is added to the anesthetic. It can cause rapid heartbeat or irregular heart rhythms, especially in patients with existing heart conditions or high blood pressure. During surgery, your medical team will monitor your heart rate and blood pressure closely to catch any issues early. Injection site reactions are common and usually minor. You might notice soreness, bruising, or temporary numbness where the anesthetic was injected. These effects typically resolve on their own within a few days. In procedures involving large volumes of anesthetic, like tumescent liposuction, there's a risk of fluid overload, which can lead to swelling in the lungs or hypothermia. That's why careful monitoring of fluid intake and body temperature during and after surgery is essential. Because of the slow absorption of anesthetic in some techniques, symptoms of toxicity might not appear immediately but could show up hours later. This makes post-procedure monitoring important to catch any delayed reactions. To keep risks minimal, surgeons follow strict guidelines on the maximum doses based on your weight and the type of procedure. They also use the right concentrations and volumes to prevent systemic absorption. Continuous monitoring of your heart and neurological status during and after surgery helps catch problems early. It's also crucial to select patients carefully, especially those with heart or liver issues that could affect how the anesthetic is processed. In the end, local anesthesia is considered safer than general anesthesia and is widely used in plastic surgery. Still, being aware of these potential risks allows your surgical team to take steps to prevent complications and respond quickly if they occur. Always have an open conversation with your surgeon and anesthesiologist about your medical history and any concerns. Remember, personalized care and careful monitoring are key to a safe and successful procedure.